Cancer is the #1 killer in men and women in Latino communities, so I think we need more Latino advocates.
I'm Deb Ontiveros, Diana Garibaldi,
Jose Adorno Soto,
Mignalis Nani Vega Morales,
Melissa González,
Mónica Vinci Guerra,
Claudia Pérez Favela,
Carolina Uribe,
Arnoldo Rodriguez,
JC Cantu,
Karen Estrada, and I'm from Medellin, Colombia, and I live in Miami, Florida.
Cedar City, Utah.
I live in Miami, but I'm from Puerto Rico.
Chicago, Illinois.
currently living in Ohio.
I am from Puerto Rico, but living in Delaware.
So I'm originally from Puerto Rico. I live in Miami, Florida. Brea Valley, California.
I live in the Rio Grande Valley of South Texas.
I'm from Peru, living in Kansas City, Missouri.
from San Antonio, Texas.
What motivated me to become a patient advocate was seeing needs in our community that aren't being filled.
Not only to be a voice, but to be there for people who might not be able to say it in their language or to hear things in their language.
Through my own experience, I want to help them give themselves a voice and speak up for themselves.
My experience with the health system motivated me to be a patient advocate. I don't want more people like me to going through this without guidance.
I felt that it was incumbent on me to help other cancer patients find the best possible cancer care for their particular type of cancer.
It was my kids. I wanted to show them that we never give up and that our story matters.
Programs like this are very important because there is not a lot of representation for Latino in research.
So we need this in our community. There have been other opportunities that are broader, but this is specifically for Latinos.
It's very important for me, and I guess for a lot of people, to have and know the resources that we have.
To help the Latin community to communicate better, to navigate better through clinical trials, pharmaceutical research, and every aspect that can bring them openly to receive the best care that they can receive.
It was a lot of information, but it was great resources, good community, lots of great questions. And what I love the most is that nobody's afraid to share what they know. They're willing to give you what they've learned. They're willing to give you what they've studied. And that's great because it will make the community bigger and bigger.
The session on clinical trials, how they're made, how they're done, how to come to those decisions, kind of getting that peek behind the curtain. I'm ready to share more with people about what that decision-making process is and how we can influence it.
I enjoyed learning about clinical trials. That's a question that has come up often. So I feel like I'm better prepared now to answer questions about clinical trials.
I really like the genetic counseling. I think with genetic counseling, we can learn more how to empower other people to get to know what is the history behind their cancer.
The explanation about genetics, how the genes work, because there is a lot of misconceptions about cancer, and that's one of the most important things that we need to educate our community about.
The fact that I was able to speak up, that companies such as Pfizer and other companies, they were listening to ideas. They sounded so enthusiastic that they wanted implemented, and that means that our stories and things that we went through, it's going to make a difference for others.
It's make that bridge of trust, because all the good information that we take from this conference is just bringing to the people that is in need.
Bring more education to my community to be able to explain better how cancer research works, how important clinical trials are for our community.
Sharing with my own community. That's starting from my kids' school. if we actually start from the root of everything, which is the people around us, then eventually the bigger picture is going to come.
I plan to integrate the advocacy portion of that in such a way that I can instantly make a difference for those in my community, whether it's through social networking, through getting in front of the key doctors in my local hospital that need to know that we're there to help them as well, and that we're a resource for them.